Botox and fillers?
Side effects, trust me, are only in the hand of the beholder. In seeing those movements, and tell me, what do we need the frown for? Do we need to look angry? We don't need to look angry. But that is not Botox. It's because you've used a product that's bad. So use the right product
Do your
and
research.
use the right practitioner. 1/3 of that is breaking down every day. So it's like flushing again and again and again.
Okay.
So it's an enzyme that's just breaking it down. Absolutely don't do permanent fillers, because with permanent fillers there's a question mark. Seborrhea.
What's seborrhea?
Seborrhea is excessive dandruff or excessive oiliness of the scalp. Very hot water, extremely hot water is friction on the skin. It increases pigmentation.
How bad or good? Sugar and skin. Hi guys, welcome to a skincare chat with Dr. Mansi, who I like to call my beauty savior. You're like someone who's given me enhancements when it comes to my skin, my body and my hair. We know how important this is for women and even for men,
Yes,
right?
absolutely.
So Dr. Mansi is head of medical and a dermatologist at Kaya Skin Clinic, and they operate all across the GCC. I have been a Dr. Mansi loyalist and a Kaya loyalist for I don't know how many years. How many years I've been coming to you? Maybe like 3? I don't know.
3 plus, yeah.
Three
possibly,
plus.
yeah.
And Dr. Mansi has helped me, like I said, save issues related to my hair loss. And also, like I said, like I'm 32 and like age, how do I look like, picture perfect and all the time. And also, issues related to facial hair that a lot of women face because of conditions like PCOS and so much more. Like I feel like I've always, felt better after I've met you about, my hair, skin and body. But Dr. Mansi, the reason why I was like, I need some time on your calendar is to kind of maybe answer some questions related to, skin, etc. that perhaps could help someone watching.
Absolutely.
Yeah? Okay.
Yeah.
So I want all of your expertise in this, quick chat that we're gonna have. But I want to start by asking you about Botox and fillers. Okay. I've gotten Botox and filler from Dr. Mansi, and there's a lot of if I tell my mom, she's gonna be like,
Why? Yeah.
Like what? And I definitely want to get into underarm Botox after this. But what is your take on Botox fillers when it comes to safety? Who would you recommend? Just give me a Botox filler one-on-one and bust the myths that it's bad.
Absolutely. So I think you hit the nail on its head when you said that, if I go to my mom will say, why? I mean, you're gorgeous, you're beautiful, why do you need it? And I've been doing Botox for how many? 20 plus 24 years almost, right?
Wow.
Now, what's really interesting is that remember when we age, right? Our face is like a sofa. Okay, so you have a little bone structure, and then you have little fat pads, which is your cushion on the sofa, and then on top of that you have the skin. Now all of that is aging together. All right, so you can keep doing facials and you can keep doing massages and things like that, but however, the volume that you're losing within, which is really making that tablecloth bigger than that whole table, you have to somewhere support that, right? And on top of that, there are these muscles. So we're all the time sitting on the sofa, isn't it? So there are these muscles that are constantly contracting. Now if you look at, let us say, the upper face, so I'm going to talk about, let us say, only one area. I do Botox all over, but I will tell you on one area. That position of the brow is very important, and as we're aging, and if you see older people, the ages, the brows become quizzical, sometimes higher, sometimes lower, and all of that because it's like a biomechanical unit. So your muscles are really maintaining that. Now, if you do, Botox early, you actually tend to prevent this whole change that you're going to see with you when you age. Now, of course, as a molecule, it's beautiful. It's so well researched. Side effects, trust me, are only in the hand of the beholder, right? So it's the person who does it. So if you really understand the whole anatomy, understand how the muscles are, it really can absolutely prevent any kind of complication. So it's really all in the hand of that doctor who's doing it.
Right.
And you can look from natural to looking like a witch, right? But then you have to just do it right. So the product is wonderful, and I use it for not only just it only for cosmetic indications, but I use it for a whole lot of medical indications, be it excessive dandruff, hair loss, excessive sweating, you just named it, and even for example, I have these little patches of eczema and injecting them also really helps. So it's used for acne, for rosacea, for a whole lot of other indications as well. Botox can be used. So it is a beautiful product. Okay, it's just that it has to be used right.
It has to be used right.
Yeah.
Doctor, acne is a very big problem.
Yes.
How would Botox help acne?
So what it does now, it reduces the secretion of the seborrheic glands, the acne producing glands. So when you reduce the sebum secretion, you actually help improve acne. So having said that, there are lots of modalities I have for acne. It's not that I jump into Botox when I'm actually treating for acne. And there's a whole lot of modalities. But at certain times, I do need to use it, and I use it then.
Interesting.
I mean, when you say sweating for that matter, I mean, hyperhidrosis. Now we know as hyperhidrosis only for the underarm, or maybe sometimes palms and soles. Some people sweat so much on the scalp, right? Some people, and I know they sweat on their groins, under the breasts, and they're so conscious about it. And only a person who sweats really knows what they're going through it.
Yeah.
It really affects their confidence. When you have to keep changing clothes multiple times during the day, you have odor along with it, right? And you're scared of sitting next to people because you may be really smelling.
It makes you self-conscious.
Absolutely, and it's really impacts lives. And just one little taste of Botox there, and you're just changed.
Yeah.
And once done, if you do time it at the right time, I mean, I've seen it lasting between 6 to 8 months. Normally, I would say Botox usually lasts for about 3 to 4 months. But in hyperhidrosis, I've seen longevity being much higher.
Yeah.
Right?
So this is, I wanted to touch base on this because summer is here.
Yeah.
Dubai is as hot as it can be.
Absolutely.
And, sweating and body odor issues, these things can make someone really, self-conscious.
Yeah.
I got underarm Botox from you. And when you told me, I'm like, what? Like, I don't think I need tightness in my muscles or whatever in the underarms. But the reason is to prevent sweating and potentially prevent, being self-conscious. And as you rightfully mentioned that, so like, can we touch base on underarm Botox and if it's safe or,
Yes, it is one completely safe.
Okay.
I mean, that's bottom line. Okay. I don't. There's nothing to worry about any kinds of high side effects because it's injections. I mean, the maximum thing that you could have is a tiny little bruise. That's about it. Okay. It takes 10 minutes for me to do it.
Yeah.
So I do a simple sweat test before to see your areas of sweating, and then I just inject it.
Right.
Now the beauty of Botox is that it just reduces your sweating to normal. So it's not taking away your sweating.
Okay.
You understand? But it's just bringing it out to normal so that you don't see those patches. Your odor really improves because odor is because of bacteria sitting there because there's more sweating. So when sweating reduces, your odor also reduces.
Yeah.
And you're just more confident, okay?
Right.
You don't have to keep using those deodorants again and again.
Yeah.
And with Dubai being so hot, I have a whole set of patients who actually come to me just before summer. That's it.
Myself
and it's more preventative, right? So you actually just feel less conscious and more confident.
Yeah, because it can get really hot. And for me, my only thing is that, listen, I need to sweat in the gym to feel like I'm doing something. Yeah. So exactly what you said, that it doesn't completely kill the sweating, but it controls it so that you don't go to a point where it's like, who's in the room kind of a situation, which is amazing. So you mentioned something, you're like, if you start the process of Botox early from a beauty perspective, so what is the right age to start Botox?
I think it's just different for different people, okay? And it's just how your muscular action is. And again, you have to know, if there's less support, remember there's more movement. So everybody's facial structure is different. Your forehead structure is different. How your eyes are different. How your skin moves is different. So it just depends on, and I've done Botox for girls very young, 20, 25 years of age, right? I wouldn't still do it for anybody below 18 years of age.
Okay.
But there it's done for therapeutic indications. When you're below 18. But above that, I mean, if your muscles are active, you're only, remember, if that's your hand, for example, and that keeps moving, right? It's going to eventually leave that fold or change the position of that brow or that facial structure. So when you relax it, and it just relaxes for 3 to 4 months, you've actually completely prevented aging on that area. Right? So you've prevented what was going wrong. So the whole idea is to maintain that balance.
So rather than waiting till it gets really, really like, movie or whatever you call it, I don't know the technical words, you're like, so would you advise someone to come and consult at least maybe when they're hitting 25, or is that?
Absolutely. If you've been seeing those movements, and tell me, what do we need the frown for? Do we need to look angry? we don't need to look angry. Why
Life.
do we need the
We don't need to look angry, but you know.
And more than that, that's very interesting, okay, is that we're constantly on our phones. Do you realize that we are frowning much more than we used to frown in the past? So when I started treating much earlier, you know, about 24 years back, you have to know at that point of time, I was not seeing so many frowns. The amount I see in younger girls now, because we're always on our videos and our, you know, looking at the phone at all times. So when we're doing that, we're using these frown muscles.
Yeah, or even when I'm working, I'm thinking about my emails. I'm like, you know,
Yes, and then we just constantly look angrier, and we see, you know, our older generations, and see two big lines there. I mean, thank God for it that we have something that can really prevent it.
Right.
And makes us just feel more confident. I mean, there.
Absolutely. Yeah.
So I mean, I really, you know, want to tell you now. I'm glad you brought this forward. That I mean, if you do it right, you don't look unnatural, right? But you have to do it right, and that's where the physician makes a difference.
So what are the things that you would like alert someone in terms of, let's say for any given reason they can't come to you?
Okay. No, I would just say, I mean, there are lots of doctors in the world who are really, really brilliant, and they're doing it very well. So find the right practitioner. Have a discussion with the doctor. And you know, it's not just about, oh, you come in Botox and I inject you. I take a full medical history. I want to know if there's any medical problem that actually tells me don't do Botox, or is, you know, like a red light. So I do that medical history and ensure that their doctor does that as well. And then, I mean, ensure that the doctor is using the right product. Don't just pick up there are so many fake products available in Dubai these days. There's so much that is coming in from different countries without registrations, and people are just trying to do it because it's cheap. Right, and I've seen so many complications of these things, and people, you know, just come to me with these nodules sometimes, but that is not Botox. It's because you've used a product that's bad. So use the right product,
do your
and
research.
Use the right practitioner. I would just say, and then you're home. There's absolutely nothing to worry.
Okay, that's good. I have a bit of a question. Where does the Botox and filler go? Like, what happens to it? Like in the body, like what? Like, okay, I've done it, like, I don't know, maybe 10 times now. Where is it?
See, you know, no, Botox is just a molecule that just goes and blocks out a particular. So, you know, the nerve is basically releasing something called as acetylcholine that actually connects and causes the muscle to contract.
Okay.
So this Botox goes and just kind of allows that acetylcholine not to connect with that, and then just goes away. It's just kind of flushed out.
Okay.
A filler, for example, is hyaluronic acid. Most fillers are hyaluronic acid. Okay. We have natural enzymes in our body called hyaluronidases. Okay. And we have about 15 grams of hyaluronic acid in our body. Okay.
Is that a lot?
Which, I mean, that's your natural amount. Okay. That 1/3 of that is breaking down every day. So it's like flushing again and again and again. So it's an enzyme that's just breaking it down. Okay. Now what you have to know is that when we inject a filler, it's also hyaluronic acid. Now the only difference is it's basically cross-linked or connected with something called as, which are connectors, which allow it to last longer and makes it more resistant to these enzymes. So it breaks down slower. But essentially the hyaluronidases break it and it's just gone. So it's not that, you know, if you do a lot of filler, now how soon it breaks? Now there are multiple questions in the world on how soon it breaks. So when we started off, we thought that the longevity of a hyaluronic acid filler is usually about a few months. But now we've realized that, you know, you can still have a little part of that hyaluronic acid filler still in your face for longer. But having said that, it's still hyaluronic acid, and your hyaluronidases are still going to break down and take it away. So it's not permanently sitting in your body. I mean, I absolutely don't do permanent fillers, because with permanent fillers, there's a question mark. Because remember, also we're aging constantly, right? So what was here is not here, it's going down, right? Now, if you put in a permanent filler there, you think it'll last longer. But because it's aging, it doesn't mold with your face.
So it'll look off eventually.
And plus a permanent product can eventually cause more complications in the body. So it's again important, again when I say hyaluronic acid, there are multiple fillers that are available. So again, discuss that with your doctor. Don't just, you know, take a cheap product because it's good. Don't just do it because, you know, this person is doing it cheaper. There's so many cheap deals, right? But do it with the right person. It's something that you're injecting into the face. I always say, I mean, we spend such a lot of money on eating out every weekend, right? I mean, just don't eat out one weekend and spend it on the right product, the right doctor.
It's your face.
Absolutely.
But one other thing that has really helped me, and I know is a big concern for a lot of people, is hair loss. So I had massive hair loss after my weight loss and also COVID combined.
Yeah.
I think I don't think I lost, like, I'd say 40% of my hair, and it made me feel really self-conscious. And you know, like, hair is like the crown, you know, not just for women but even for men. So I want to know a little bit more about the solutions, or maybe more about why PRP, how PRP when it comes to just like hair loss. Give me a crash course.
Okay, that's a big crash course. Okay, so what happens is that hair loss can be due to a number of causes. Okay, now what you're telling me about after weight loss is typically a condition called telogen effluvium. So what's happening is that everybody's hair and hair all over our body really is passing through 3 phases. It's growing, it's resting, and it's falling. All hair, and it's a churn, it continues happening. But when we go through a sudden insult on the body, which could be falling sick, having high fever, you know, going through a surgery, having weight loss, suddenly there's a conversion from the growing phase to the resting phase. So a lot of your hair, which was earlier much lesser in the resting phase, a lot of it goes into the resting and the falling phase and starts to fall. So that phase is called telogen phase. Right? And you suddenly have lots of strands of hair. So every time you comb your hair, you have loads of strands.
Yes.
Now, it's very important to first diagnose what the cause is, okay? Because every time you undergo an insult in the body, sometimes there's deficiencies of certain things that come up in the body. It could be iron, it could be B12, it could be vitamin D, it could be also very, very small trace minerals and elements in the body. So what happens is, once you've diagnosed what the problem is, then you have to really help the body build it up, because you have to reconvert. Now, once, let us say about 15% of the hair is in falling phase. Suddenly when you get a telogen effluvium, 40% of it goes into falling phase. So now only 60% of your hair is growing, the rest is falling. Now this will grow, but it's going to take that much time. And imagine how much time it takes for a hair to grow out. So it kills us, right? I can imagine that. So what is really important is to first diagnose what the problem is and then treat it accordingly. So there's a lot of treatments that I have for hair loss, and if it's telogen effluvium, I would supplement with whatever's lost. Then I would do procedures like you just mentioned, PRP, and you know, I have other procedures and injectables as well, depending upon what is needed. Now, what PRP does simply is that it's, you know, remember our blood and our plasma has growth factors, okay? And these growth factors really tell the other cells to come on, work. Right? So in simple layman terms, so when I am taking your own plasma, that is if your blood profile is good, okay? And when you're young, you have better growth factors, they act much more. So when you take the your plasma and then I inject it, I'm actually releasing these growth factors slowly, okay? Now they actually tell your cells, which are the hair follicle cells, to actually release some factors to start growing of cells. So it actually helps to slowly, one, reduce hair loss and increase growth of hair as well. But having said that, that's not the only treatment. Sometimes you have to do it with a whole lot of other combinations of treatments that are there in a doctor's armamentarium, you know. So I sometimes do lasers, I do other injectables, I do a whole lot of other treatments that are needed. If you have seborrhea, I treat seborrhea.
What's seborrhea?
Seborrhea is excessive dandruff or excessive oiliness of the scalp.
There are treatments for that also?
Absolutely.
My mom just chopped my hair.
I know we did that.
That's it. I had dandruff growing up. She made me a boy for 4 months. That's it. I thought.
Yeah, but it's also because it allows you to clean your scalp.
Right.
So you know, all of these things that our moms do have a basis to it. Okay.
We'll give her this one.
But also for men, for example, you know, when you have male pattern alopecia, that's different from telogen effluvium. That's different from an insult. So then but PRP is helpful for that as well.
Okay.
And I just talked about, you know, doing Botox in the scalp.
Yeah.
And that again helps for seborrhea and really helps reduce, you know, the scalp tension. So what happens is that you have different muscles all across the scalp, right? And they're really pulling in the galea, which is here. And that reduces the blood supply to the hair follicles. So when you actually relax all of those muscles, it's used for migraine, right? Botox is used for migraine. So in the same way, yes.
Botox is used for migraine?
Yes, it's approved for migraine. And it's beautiful for people who are struggling with migraine as well. Where again, it's trying to relax all the muscles on the forehead, on the muscles, you know, on the back of this head, on the neck. And it just relaxes them. And so it reduces that whole tension in the neck and the scalp.
You're serious?
Yes, and it's brilliant for those headaches and migraine. I mean,
Who would you recommend? Like, what level of migraine do I need to have to go for Botox?
see, if you are not getting a relief with your regular medications, you're getting frequent attacks, it's a good idea to ask your, I mean, I also treat for migraine, but you can also go to a neurologist, right, and ask for this option of Botox, because you do it once every 6 months, and it really, in a huge percentage of patients, completely relieves.
You've seen positive results?
Yes, absolutely. I have to tell you the story, and it's really great to. I was this patient who came in. He actually came in for pigmentation on the face, and he was very, very pained about it. And then he was just squinting his eyes again and again. And I just happened to ask him what happened, and he says, Dr. Mansi, I have this terrible headache for the last 20 years, and I've got everything investigated, but every time I'm out in the sun, I have this terrible migraine, and for the last 20 years I drive with a cloth on my head so that I reduce the pain. So I told him, and I gave him the option of Botox, and I said, listen, you've come in for something else, but I can tell you this can be life-changing for you. I mean, the worst that can happen is that it's not going to work, okay? Yeah. But and it just does mean some money, but I really want you to think about it. And I don't know, he just did it, okay? He came to me about 3 weeks later, and he told me, you have changed my life. I drive out in the sun without tying that cloth around my head, and I'm so relieved. I sleep better, and this is what we as doctors do, isn't it?
That's
that's what makes my life. Yeah.
Can you believe it? Botox for migraine. Oh my God! You might have just helped a lot of people. Yeah, that's amazing. That's great. That's really, really good. But you brought up my next topic.
Okay.
Pigmentation. As a brown girl who's had PCOS, who's used shavers and lasers and I don't know what not around her mouth area, I have felt so, I think till date I feel self-conscious because of pigmentation around my mouth. And I don't know, maybe does it exist more for brown people? I don't know. But doctor, pigmentation as a brown girl, tell me more, tell me how to take care of it, give me your insights.
So, the different skin types, right? So we have, as a medical person, we say type 1 to type 6 skin. So, it's different in different parts of the world. So an Indian skin is typically that mid-brown skin, like you said, which is basically more prone. So the way our skin heals, it heals with pigmentation. Okay, so whenever there's a very bad insult on the skin, it could be sun exposure, it could be just heat, it could be the extreme dryness, right? All of these things will actually, the skin feels that let me produce some pigment to protect myself, because melanin essentially is a protector. Right, we age much lesser than the Western skin type,
right?
The fairer skin type, right? And that is because we have that melanin. So melanin essentially is a protector. Okay. Now, what's happening in our kind of skin is that we are constantly prone to insults, right? Every little sun exposure is an insult. There's UVA, UVB, there is visible light, all of that. That just tells our skin, okay, produce some more melanin because I want to protect myself.
Okay.
Okay, and that's exactly what's happening. But in addition to that, on brown skin, see, if you look at your hand ever, there's a darker area and a lighter area, right? So there's basically like a demarcation line that you usually see. And these demarcation lines on a brown skin are also present around the mouth. They're also present around the eyes. So sometimes we have certain areas that are really darker. Okay, and so again, it's important to see the right dermatologist to understand what the cause of that pigmentation is. Is it just a physiological pigmentation? Is it just a part of you? Or is it actually something that's happened with a lot of changes in the body or insults in the body? Now, a lot of times on the face, just remember, friction in our skin increases pigmentation.
You mean movement?
Friction, rubbing. So if you touch a lot, if you use a lot of products, you keep using a lot of scrubs, this on our skin can actually produce more pigmentation. So again, using a lot of scrubs and rubs and loofahs, I see a whole set of people, with pigmentation on the back.
Because they're constantly,
and they try and think it's dirt, and we try and keep rubbing it out, but that's not the right way to do it. In fact, our skin has to be treated exactly the opposite way.
Leave it.
No, we have to treat it in a softer fashion. So the first thing that's important is that after very hot water, extremely hot water is friction on the skin. It increases pigmentation. It leaves our skin more dry and is prone to pigmentation. So one, try and bathe with less hot water. Two, after you've done your bathing, apply a good moisturizer, or simply, if you're not very oily skin, just simply oil on the skin. So moisturize your skin well. And remember, moisturizer is absorbed within the first 3 minutes of bathing when the skin is really wet. So if you dry it out, or you just go home and use a moisturizer, it doesn't get absorbed well. It has to be on a damp skin. Yeah. Now, third thing that's very important is to wear a sun protection cream, and it's very important for our brown skin, because what's important is that we keep looking at SPF. Everybody talks about SPF, but SPF really is for is UVB protection, and that's more for skins that burn. Our skin doesn't burn. Our skin pigments out, tans, right? So what we need is, what you should look for in a sunscreen is UVA protection, and also visible light protection. And this is very, very important. So next time you go buy a sunscreen, everybody buys a 50 SPF, 100 SPF, but you have to know the difference for a brown skin between a 30 and a 50 SPF is not huge. It's just 1% improvement, right? But what's really important is that it has to have visible light protection, like a blue light filter, a visible light protection, and also a UVA protection. So you'll see this Boots factor or PA factor, which is written on the sunscreen. And that is also something that's very important. 3, wear your sunscreen well. So, fill the center of your palm. You have to do that much sunscreen all over your face. So it's either the center of your palm or 2 fingers.
I've been doing it wrong.
Yes, and we just use 5 dots. And then I always say sunscreen is in your head, it's not on your face. Okay? We've just not used it, right? And 2, if you are prone to pigmentation and you're going to be out, you're going to step out for lunch, it's important to reapply.
Yeah.
Because we don't have sunscreen lasting for a longer time. 3, again, it depends on your skin type. So if you have certain areas of pigmentation, this is prevention, and it's very important. I can tell you that we are much more out than our parents were. Do you agree? There's far more insults on our skin than our parents were. So once you've reached that, when you start seeing those changes on your skin, it's important to start using some form of an exfoliant, which will actually naturally regenerate your skin. Now this could be retinols, it could be your alpha hydroxy acids, your beta hydroxy acids, but you have so many products on the net, and I have these patients who come in and every day they have a new product because they're following some channel and then another channel and then another channel. But I would say, it is your skin, and once they've spent 10,000 dirhams is when they come to me, right? So go and meet up with your doctor, choose the right products. And sometimes what they do is right, okay? I'm not saying they're always wrong. Sometimes they've really figured out what works for their skin. But it is a tough journey. So I think choosing that right product to moisturize your skin, hydrate your skin, and also exfoliate it in the right manner, rather than using a lot of scrubs and rubs. And they're not bad, but once overdone, they cause more pigmentation. 3, overly touching your face. So you touch your face, you rub your face, all of that can actually cause more pigmentation. On the lips, for example, pigmentation on the lips could be related to lipsticks that you're using, could be related to toothpastes that you're using.
Oh, toothpaste.
So a lot of things actually can irritate that lip area and cause pigmentation as well. So again, a whole lot of these matte lipsticks that are extremely drying can actually cause problems. And there's a condition called contact allergic dermatitis or an irritant dermatitis that can happen because of contact products, of certain things that we're using.
Oh, wow.
So pigmentation is huge. I mean, I can talk for hours on pigmentation, but the whole idea is it's important to prevent and take away the cause. So for example, we talked about underarms, right? Sometimes there's pigmentation on the underarms.
Oh my god, biggest issue ever, dark underarms.
Yes, but sometimes it actually could be related to the excessive sweating that you're having, bacterial deposition there, and then friction. When we're going to the gym, we're wearing such tight clothes. Okay, and in a brown skin, the tightness of clothes and rubbing on the skin
friction
can cause pigmentation on that area. So again, it's important to diagnose it right, and of course then we have a whole lot of products. I mean, there are treatments available, there are lasers, there are peels. One more thing I wanted to say here, a lot of people are doing lasers, okay, and I'm not saying that I do it right, okay, and I know
I'm saying that you do it right.
The whole idea is that the answer to a problem is not just let me do this laser, okay? You have to diagnose what the condition is. If somebody doesn't diagnose it right and you just do lasers, you'll be very happy in the first few months, and then you'll land up with problems a couple of months later. So it's, again, I would reiterate, let's diagnose it correctly, and then there are a lot of tools in that toolbox that actually can help that.
Yeah, I used to think laser is only one type. It's after, meeting you, I'm like, oh, there's a laser for this, there's a laser for that, and there's a laser for this. So no, I agree. I want to ask you something that I get asked a lot about on my page, and again, it's connected to my weight loss, which is loose skin.
Okay.
I don't think any clinic in the world has a solution for this, but I want you to give me the realistic answer. Can anything resolve issues of loose skin?
Maybe 20 years back, we didn't have an answer to this. Even maybe 10 years back, we didn't have a complete answer to this.
Okay.
But loose skin can happen anytime, right? It can happen when you lose weight. It can happen post-pregnancy. It can even happen, for example, I've seen stretch marks even in young girls who gain weight, right? And who have a sudden spurt, they also tend to have it. Now, all of this is very similar. Your elasticity of the skin is lost, and somewhere that firmness is lost. So, you have collagen in your skin, and you have elastin in your skin, okay? And then you also have that hyaluronic acid, which is called the ground substance of
Which forms things.
Which firms the skins. All of them together work. So whenever you're working at loose skin, one, you have to see how much loose skin there is, okay? So if it is minimal and you can just pinch it out, and there's just that crinkly kind of a skin, it works brilliantly. You have there are machines that are available. So now, depending on the kind of skin that there is, I can use a non-invasive machine, a radiofrequency machine, or I could actually use a microneedling radiofrequency machine. But with that, there are beautiful injectables that stimulate this collagen and elastin, what I call the matrizome, which is literally your foundation to that skin. So it actually stimulates that and tightens out the skin.
Right.
Then, in addition, I have these beautiful enzymes that are available, okay? And these enzymes are a combination of collagenases and lyases. Now, remember, whenever you have laxity, all your collagen is not good collagen. As a layman, you'll understand that. So when I inject this collagenase, it breaks down your poor collagen, which in turn stimulates new collagen. Do you understand? So it actually helps to treat that area in terms of laxity. If there is fat, I work on the combination of fat and laxity. But if there's only laxity, then I have to work on that.
Laxity means the skin is loose.
Skin is loose,
Okay.
skin is loose, or it's hanging, right? But if there's excessive skin, like I can pinch in a huge bundle of skin.
Like you mentioned 2 inches. So what's the threshold?
So, almost up to an inch, I can reduce.
Okay.
Almost up to that.
If it's loose skin, up to an
If it's loose
inch.
skin, I can reduce. But if it's more than that, and you can pinch a good amount of skin, but without fat, you understand? Then possibly is a surgical case. Right? So it depends from person to person, because what I'm trying to do is stimulate that collagen and shrink that skin. You understand?
Stimulate
shrink
the
it out
collagen.
and improve that. So you shrink the skin, improve the foundation or the matrizome that I call it, and it improves that laxity, that looseness of the skin, as well as your, the stretch marks that you might have.
Right. So let's say that the skin is under 1 inch.
Yeah.
Okay. So it's curable. Like the loose skin is, it can be taken care of. What are some of the non-invasive treatments that you could potentially look at? I'm only asking this so that anyone watching could ask either you or their dermatologists, for that kind of common treatments.
So usually what I use in what you call in terms of machinery or devices, basically energy-based devices, okay? And these, if there is no fat, if there's minimal fat, then I don't use a machine that reduces fat. I most commonly use radiofrequency devices, and which could be non-invasive multipolar or bipolar radiofrequency devices. And then I could also have microneedling radiofrequency. A lot of people know the name of Morpheus, Secret Duo. I have a Vivace, a lot of these machines. So if used right, they can actually help to tighten out the skin. And then there are these bioremodeler products, which basically could be a combination. There are 3 different kinds, okay? There's one which is like a powder. For example, you have something called as polyl-lactic acid that very simply people know as Sculptra, Lanluma, right? Or you have calcium hydroxyapatite, which is very commonly known as Radius, okay? And then you have these hyaluronic acid solutions with peptides, okay? Now these peptides also have a rebuilding effect of the skin.
Okay.
So it's just once I diagnose with the causes, do I want to improve firmness? Do I want to improve, what is it that I really want to improve? Then I choose it right. And then you have these enzymes, which is the combination of collagenase. And I think they've been groundbreaking with the results that I've seen with them, because it's really remodeling your skin naturally. Okay, it's not about putting in something unnatural there to improve it. It's actually just making your own body remodel it naturally, and that is what is the beauty of it. A lot of times I also do little tiny hyaluronic acid, more like to improve the quality of the skin. If if there is really a space that's there, I may actually use hyaluronic acid to improve that as well. But most commonly, it's more bioremodelers.
The area that you're visualizing when you're answering this is mainly the stomach?
This is the abdomen. This is also, most commonly it is seen on the abdomen.
Right?
Most commonly. It's also seen on inner thighs. It's also seen on inner arms.
Yeah.
You know, when you lose weight, when you age. See, what's also happening is we're aging, no? Is that there's sarcopenia that's happening. So we're losing muscle. Okay. Now, as we're aging, if we're not, we keep trying to lose weight, and with all of these, you know, these weight loss drugs that are available, and they're amazing for a whole set of people who are very obese, right? You have these.
You mean like Ozempic,
like
and Mounjaro?
Ozempic and Mounjaro and all of these drugs. But what's happening along with it is that they're losing muscle. So remember, when you lose fat and then you lose muscle as well, then there's nothing for that skin to hold. So it also loses. There's more laxity. Right? So a lot of people where I also check the muscle. So if there's muscle loss, I would also work at the muscle, because sometimes when I improve that muscle, I actually also improve laxity.
You brought up something very close to my heart, which is muscle, because I'm obsessed with the gym. And a lot of people are like, oh, why do you need the gym? But how does muscle help the look of the skin?
I mean, it is a filler in a way, right? But I mean, you may think of it very superficially, right? That the muscle is a filler and it builds, but you also have to know it really protects our bones. Okay, so when you do that's why a whole lot of patients who are on these drugs and losing weight, the one thing that I tell them is that you have to build your muscle. Okay, and if you don't build your muscle, so you know, if your muscle is very lax on the abdomen, for example, you may actually have back pains. If your muscle on the thighs is bad, then you may actually have problems with your bones and your hip joints. So the same for all over the body. So building muscle, and I really think that as we age and when we're close to menopause, muscle goes down like that. So it's very important that we start building muscle early in our lives. But I'm not saying you have to look big, right? But you have to really strengthen that muscle, which is your abdominal muscles, your thigh muscles, your arm muscles. And yes, it does a lot to the skin, because it really does help. It works like a filler for the skin. So it really does stretch that skin out. So it's extremely important to build muscle. So, you know, now there are FDA approved devices that are available, which actually cause like supramaximal contractions of the muscle that can really build up that muscle. So what it's simply doing is that's causing tiny breaks in the muscle that allows your own body to rebuild it. So a lot of patients who cannot exercise, who've got back pains and things, and they can't build muscle, I mean, they're lost, right? So for these people, these devices can be life-changing, especially close to menopause.
Wow.
So the patients who can't do squats because they have knee pains. So for them, I use these devices to actually build muscle.
You have them?
Yes, I have them as well. And again, it's what's really important is that it's not the regular EMS devices. It's these devices actually are FDA approved, and they actually help build muscle.
I love that.
Yes, but that doesn't mean you shouldn't exercise. I mean, one should exercise, because I think exercise also releases these beautiful hormones that make us feel nice.
Absolutely. Okay, last question. How bad or good? Sugar and skin. Let's put it like that.
Oh.
Sugar and skin
is extremely close to my heart. Okay, and I think in modern everyday life, what has really impacted people is the sugar. Okay, and sugar, I can literally see changes of that glycemic index change in the body on the skin. Skin is like a window to the body. Okay, and when there is a change, sugar is extremely bad for the skin. Okay, not only the skin, for the body. And it's not only sugar, I want to tell you, it's these refined carbohydrates. So a lot of these pastas and pizzas and breads all the time that we eat, it immediately raises up the glycemic index. Now remember, for a little sugar, a little insulin is produced, right? Because insulin has to keep the sugar in control. But what's really happening is that when you keep eating the sugar, your insulin level starts to rise, and they kind of want to control the sugar. But every time you're only investigating your sugar, and that comes out as normal. But then as a dermatologist, when I see simple changes on your skin, which could be you're gaining weight, I mean, your metabolism becomes poor, right? You start getting these darkness on the underarms, on all your folds on your neck. You start having hair loss. All of these things are actually a direct change because of insulin resistance. Yeah? And that insulin resistance also causes further metabolic changes. Your absorption of the gut becomes poorer. So your iron levels fall, your vitamin D falls. The whole metabolism of these become poor. So I really think that the biggest change that we have to bring in our lives is really reduce the whole sugar consumption in our skin, and it really makes, with relation to acne, with relation to PCOS, with relation to metabolic changes, hair loss, all of these are somewhere linked to that sugar. And one very simple, I don't want to just say to everybody that everybody needs to take it, but one of the biggest anti-aging drugs that are being talked about is metformin, which is actually an anti-diabetic drug. Okay, it's metformin. Now metformin, what it's simply doing is just reducing that insulin resistance. So a lot of, and it's been shown to have other visceral improvements in the body as well.
Is it like glucophage?
It is the same as glucophage. So the content of glucophage is metformin. Again, it's not for everybody. You have to know that. Okay, what is really important is to go to the right person and diagnose it right. If you have insulin resistance, it's going to cause far more changes in your body. Now let us say you are 10 kgs obese, okay, and I tell you, you have to lose weight, exercise, and you try for the next 1 year and you're not able to lose weight, okay, but all of that insulin resistance is causing far more changes in your body. So at some point of time, there is a medication required. But then if you can do it naturally, there's nothing like it. There's nothing like it. Absolutely.
So what are the common issues that you notice in the skin or hair, like you said, hair loss, that are a direct result of increase in sugar consumption?
So again, it's directly more related to that insulin, that glycemic index being higher. But it could be seborrhea, it could be excessive dandruff, it could be excessive oiliness, it could be acne, it could be your skin you're not realizing why it's dry and why it's oily. So sometimes your T-zone becomes excessively oily and you start getting these little eruptions there, but at times it's dry and you don't know. Then you could also have excessive darkness, like I said. So it's not darkness, it's thickness of the skin. It's actually called acanthosis nigricans, where your back of the neck becomes dark, and a lot of people think it's because of the chains they're wearing, but it's not really that.
I have to tell you this. I had the exact same problem. If somebody saw the back of my neck when I was big, my mom would be like, Nikki, do you not clean your neck? Or what are you wearing? And now you're telling me that it's because of and I'm not even kidding, after reversing my lifestyle,
it's changed,
It's changed. There is no darkness. I can show you my neck right now. I have a tattoo,
It's amazing, isn't it?
Like, it's...
So we have to get that metabolism of the body right. So skin is not just superficial, and it's not just skin deep, right? There's so much that's going within the body that actually impacts that skin on the top.
Wow.
So it's just, one has to treat it right, diagnose it right.
So much to know. No, but I really, really appreciate your time, and thank you so much for sharing all these insights with me and everybody. And we'll see how this goes. But I'm so grateful to all the beautiful changes you brought to my skin and hair. It has really helped me feel more amazing about myself, more confident. So I appreciate you so much.
Thank you, Nikki.
Thank you.
Everyone.
Thank you.